All right. That might be a little too low. Let me say good morning. Good morning, Mrs. DeFreitas. How are you? Can you hear me? Hello? Hello, good morning, Mrs. DeFreitas. Okay. Hello, good morning.
Douglas.
Yes, okay, great. Got you. Good morning. How are you? No. I have met you, and I assume that you are not 100% of Caribbean originality. All right. So this theme song that I'm playing here. All right, it's by one of the Caribbean's most loved artists. His name is the Mighty Sparrow. The name of the song is Precious, and it's something.
Familiar with the song.
It's something that I use, for moments in my family when I would be addressing a birthday or whatever. To me, the song is very meaningful, wherein that and not only that, it comes from us. It comes from us, and it gives an appreciation of the female sex. In a lot of ways, us as men could see what is on the outside only, but what is on the inside is even so much more beautiful. And the fact that the outside can be tainted with matters of what we're going to talk about this morning, I thought I would use that to let the female members of our audience know that at CTView Multimedia, we feel your pain, that we understand your concerns. As a matter of fact, I did some research on the matter, and it's not uncommon for persons to be suffering from what we're about to talk about and not even realize it. And not knowing it, I think that might think that they have an upset stomach. I remember one time there was a young lady that worked for me that I think I might have saved her life, because she was feeling sick, and she's saying, well, when she feels like this, she just take a hot Guinness and it is fixed her. I'm like, no, don't do that. Go and see. And I think I paid for her to go and see Dr. Tony. Dr. Tony found out that her pressure was sky high. And had she had taken that Guinness, as she thought can solve the problem, we would have a real problem on our hands.
Indeed.
Good morning, Mrs. DeFreitas from Health Solutions Incorporated.
Good morning,
welcome.
everybody.
Yes, good morning, and thanks for accepting our invitation. Talk about
anytime.
Fibroid Awareness Month. Like I said, I breathe when I hear about it, because it's something that can be so close to us. 80%, I did the research, it says 80% of persons of African descent are likely to have it. 80% worldwide, and to some degree or another. So the floor is yours, Mrs. DeFreitas.
So good morning, everybody, and thanks for having me on. Generally, I think when we do these shows, we do it about diabetes, high blood pressure, kidney disease. But we've been fortunate in the last, I guess about a year and a half, a little bit over a year and a half. We kind of ventured into women's health at the clinic. The need came, and we started with it. And initially it started with some of our ladies who come in for our hypertension clinic. And we realized that they were starting to, complain about, reproductive issues. And, we started and we rolled with it more or less. And this month is actually become, quite important to us as well. And we're trying to bring awareness, even though we're in a state of COVID, social distancing. This month, Fibroid Awareness Month. So, and fibroid actually, it's quite common in the Afro-Caribbean women. And it's something where this particular population in this region is almost 3 times more at a chance of developing fibroids. And being of the Afro-Caribbean population, genetically already you're predisposed to certain illnesses such as diabetes, high blood pressure. The women have a higher tendency to be overweight. All of these things also fall into the reproductive health. Our estrogen production, and developing the fibroids. It's incredible how many women now we have in clinic who come in. Sometimes they come in, for their general annual women's checkup, and then just by chance, as we're asking them questions, we realize, wait, there's something going on in there. Now, women we're resilient. We take on pain. A majority of us have great high pain tolerance. So what we do have certain complaints that come when we get our monthly menses. We automatically say, oh, well, it's the period that's causing this pain, this discomfort. But as time goes by, a lot of these women will complain that their monthly flow on their periods have become heavier, where they have to change their sanitary pads more often. Some start to say they may have to take a day or 2 off and go on sick leave. Some will complain that their pain is unbearable. They may have to, warm compresses is no longer working, or taking anti-inflammatories, or something as simple as paracetamol to help them with the pain is not working. And that's when we started realizing there's more and more of these fibroids that we need to investigate. So a lot of people will say, well, what is a fibroid? Is it a cyst? It's actually not a cyst. Medically, we call them benign tumors, benign being they're non-cancerous. Almost always a fibroid isn't a cancer concern per se. And then they fall under tumor family. So fibroids are made up of smooth muscle cells and some fibrous tissues. Fibroids tend to grow in or around the uterus, the womb that carries the fetus. And it's very important to us because what tends to happen as these fibroids develop, they grow a lot of the times, and some grow to a point where we have women that come in who look like they're in their second trimester pregnancy, but it's actually not a pregnancy, it's the fibroid growing. So as you see, it takes a huge impact on the female body. These are things that, some are fortunate to have them, and they really are only small amounts. They have 1 or 2 maybe, and they may not even grow. But some women will come in, and you could see it. A lot of the times the complaints that women come with are, they're getting backache, they're getting low pelvic pain. Their periods are starting, like I said, to fluctuate. Some women will even complain that they actually have spotting in between periods. And then later on, when some of these fibroids are really big, they start to have issues when, when we're going to urinate. Women feel that they have this frequency of, the need to urinate. Some will complain about constipation. Some even actually complain about pain during sexual intercourse as well. So they truly are a nuisance that are growing in our body at times.
And you see, and which is why, because something like that, like you said, most of the time people come in for a regular checkup and don't realize that is the problem until they're checked out properly. I mean, for the most part, sometimes because, people don't always tell the truth. And I might want to lie about certain things, so, like take for instance the last part, a couple might be together and they say, well, I don't want to have sex with you tonight because it pains me every time. And I'm like, yeah, you're just saying that, so which is why, I think that this is so important. Is there any research that pinpoints this? That pinpoints anything with what is habit cultural, with curbing people's diet, anything like that? That would.
Well, the thing with fibroids is, I think maybe in the last decade, more attention is placed on it than it was years ago. It's now in the last decade that we're seeing women actually be strong and confident to come forward and talk about fibroids. I think that's where things are starting to change for the better, is that we are now speaking more about it. It's not something that we hide from. And studies are now being done more and more. And if you no matter how many studies that have been done, believe it or not, we still don't know what is the exact cause of a fibroid, which is truly unfortunate. But there are some things that we know what might be causing it. So when we look at fibroids, I think hormone plays a huge factor in it. So our reproductive years, we start to develop estrogen. That's our female hormone. Estrogen levels are generally rise during our periods, and then after, when women are starting to get into menopause, those levels tend to start to drop. And women who do have fibroids that haven't need surgical interventions or anything like that, they start to actually shrink. But it's that prime years of 20s, 30s, 40s that we're seeing it. Number one, it's the estrogen. Fibroids like estrogen. They like hormone. So estrogen is one of the biggest issues. So when women do come into the clinic and, during the pelvic exam by the gynecologist, she realizes there's something there. The advantage is, while you're there, if you need an ultrasound done, we could actually do the ultrasound right then and there, and we pinpoint to see, okay, yes, there are fibroids or it's cysts or, any other medical issues. So you're looking at that. So estrogen is one of them. So we tend to do blood work to look at the estrogen levels to actually see, is there a rise in estrogen levels. One of the other things that we look at when we talk about fibroids is we speak to the women in the clinic about their diet. There has been a fair amount of evidence that's showing that alcohol, caffeine, can actually diets that are high in red meat, that actually increases the risk of fibroids and fibroid growth. And then we look at weight. Women who are actually overweight or obese have an increased risk of fibroids because they have generally higher levels of estrogen. So these are the things that we start to pinpoint at. Because we don't know the exact cause, we could only go by knowing what study is telling us these are the things. So that's when we start to investigate. We have had a few cases in the clinic where women came in and they have fibroids, and after we speak to them, their periods are not too heavy, where it's not imposing so much of an issue in their lifestyle and everyday life. So these women start to change their lifestyle. So we look at, some of them lose weight, some of them take on exercise, some of them take on a more protein. The protein is a plant-based diet. And you actually see when they come 3 months later, they do report that they are seeing a lesser issue with their every month period. And then when we do a follow-up ultrasound, sometimes we actually see that the fibroids have gotten a bit smaller.
And this is done with the state-of-the-art equipment that you now possess at
Pardon me?
These tests are done with the state of the equipment.
So that's the advantage, right? We're offering a well woman clinic. I'm a woman, and for years, for everything I needed to do, you go from one place to one place to one place. Then you got to go one place to one place to one place, collect your test, then come back. We want to avoid that stress in the clinic. So we created a well woman clinic, and we like it because women come in. Sometimes there's very little wait time, and you're in. You actually get your female check done. You get the gynecologist to assess you, your pelvic exam. If anything is concerning there, right then and there, the ultrasound could be done. When women come in and they're at that age where breast health is important as well. So, we speak to them about their breasts. Are there any lumps? An assessment is done. Anything detected? If you are at the age of 40 and up, you could walk right across the room and go and get your mammogram done. It's supposed to be, being a woman for years, it's complicated. There's a lot going on in our bodies. And if I can make it, if we at Health Solutions can make it easier for you to have these done as a one-stop shop, then I want to be able to provide that. I'm a woman, so I know exactly what it feels like. I tell my patients, I know what you're going through.
I hear you. Well, I mean, it's moments like these that I hope that it's teaching me to be more sensitive, more sensitive to the needs of.
Yes, and you know what? I have to say, I have had some wonderful men in the clinic being a great support system. Sometimes when women come in, like let's say if they know that they have a fibroid and they actually come in to discuss what are some of the treatments that we're offering, and the sense of relief as to how do we deal with this. A lot of the times their significant others, their male partners come in, and they're good. They'll even come to me and they'll be like, Miss Pauline, every month, 7 days, 10 days, it's quite painful. I want to see my wife, my girlfriend, whomever. I want this sorted out, please. And then it's funny, like recently we had a fibroid epilization case that we had done in Trinidad. So the patient came back, her significant other came back with her.
It's very and came in with a big smile on fibroid his face. Epilization? Speak,
yes. So it's a procedure I'll actually tell you about. But her significant other came in with her, and he had a huge smile on his face. And I said, I'm getting a smile today. And, he laughed and he said, it has been a blessing in the last 3 months to see my wife go through this transition, because he said she's so much better with her period. So it definitely is. We want men to know about it, because when men present themselves to the clinic with male-related problems, we want to be able to help you through that as well. So the same falls on the impact of women. Sometimes it's a bit more detrimental, because this may cause issues with pregnancy. This may cause issues with your sexual health. All of these things causes an impact in your life. Your
general demeanor itself. I mean, it could, like yesterday, I was doing some preparation for this thing, and I had to move some furniture around and forgot that there was a heavy lock at the bottom shelf of the table that fell on my toe.
Oh boy.
And that has affected me since, I had to pick a different shoes to wear. So, I mean, can you imagine the discomfort that, having that nature of a discomfort, how it can change your sense of self, your sense of
having periods is one thing. Where we're women. When a young woman gets her period, a lot of the times a mom, an auntie, a granny, a sister, somebody tells you how these things are going to come every month, and these things help you, become a young woman. This is what helps you in the process of trying to become a mom and get pregnant. But nobody really says, guess what? There are issues that are going to come with this. You may develop certain medical issues because of it. That talk doesn't generally happen. We're taught as to, yes, we get it and why we get it. But later on in life, issues do arise with the reproductive tract that you need to address. And fibroid is definitely one of them. And like I said, in the Caribbean, the numbers are really high. Genetically, that's just how it's predisposed. So do we want to help the population in the country who are suffering from it? Yes. A lot of the times women actually will call and say, listen, the last 2 months my periods went funny on me. I don't know what it is. You think I have a fibroid. And it's nice to know that the women are listening, hearing, and they are aware of something called a fibroid that may impact and fluctuate your periods. And then catch it early, and let's help you treat it early. I think coming to the catching it early is how do you detect it? So as I said earlier, when you come in and get your annual checkup, or you come in with a medical complaint to the gynecologist, you do a pelvic exam, and a lot of the times the gynecologist will say, yeah, I think there's something there, let's look at it. And then you do an ultrasound. Ultrasounds, fairly easy, they're non-invasive, and I'm sure many of our listeners today have had an ultrasound somewhere, in their lifetime. And it's quite easy, just visible, you go in and we look. I think where with females it gets a little bit sensitive is that sometimes when we do a pelvic, where we are putting the probe on the lower abdomen of the female pelvis area there, and you may not fully get the full images that you want, then we have to go in and do something called a transvaginal ultrasound, where it's a probe that's actually inserted into the vagina. Mm-hmm. And I think this is fairly new in the last few years in St. Vincent. Years ago, I remember when I had to get one done, I called everywhere. Nobody was doing them at that time.
There's something with a camera.
It's actually the same probe that's on the outside, but a different one. So it looks like a wand.
Okay.
It's thin and it's long, and it actually goes into the vagina. Okay. And it actually helps us get better images internally as to what's going on with the reproductive tract. So we look at the ovaries, we look at the tubes, we look at the uterus, and then we're able to actually get good images as to what's happening.
All right.
So it's fairly easy. And then when a woman is diagnosed with fibroid, then we start doing some blood tests as well. And we look to see, is there a rise in hormone levels? There's something internally that's causing these fibroids, and then go from there.
All right. Speaking of, we spoke about a lot about the diagnosis itself. What are some of the treatments that are available? What, like you mentioned that surgical procedure that was done in Trinidad.
Before we get to that, we try. We look at every fibroid case based on what it presents. Mm-hmm. We look at the type of fibroid, we look at where it is, the size, how many, the side effects that it's causing. So every case is looked at differently. When we look at treatment options, so number one, we start with, oral medications to see if there's something that we could regulate your hormones. Is there something that we could give to bring down or stabilize your estrogen levels? Then we also look at something called myomectomies, where that's done locally here. And a myomectomy is where they go in and remove the fibroid or fibroids. Okay. We like myomectomies to a certain extent because as you go in and you get them removed, it helps if you want to have children. Then it's done so that, in the hopes that after the fibroid is removed and healing has taken place, that you are, you can have try and get pregnant. The problem where we face with myomectomies is a lot of our cases that come to us is that they have the myomectomy done, but then the fibroids grow again. So sometimes once or twice somebody has a myomectomy done, and then when they feel that is not their best option, then we look at, okay, what is the next step? And for a year and a half now, we came across the uterine artery embolization. I just call it embolization. Embolization is actually not invasive procedure. It is done in Trinidad. You need a specific type of operating theater that we don't currently have locally. So it's done in Trinidad, and it's done by our interventional radiologist, and he's fantastic. And we've done some cases here in St. Vincent, and it's actually been a positive response. And like I said earlier about that couple that came in, the young lady, her first priority wish list was shorter periods, lighter periods, and I don't want any more sick leave. I got to get back to my life together. And that's what ended up happening. So she had fibroid embolization done. The procedure is, like I said, non-invasive, and what the doctor will do, the radiologist will do, is go in with like an IV line, go in the artery, and put in these agents that actually what it does is it blocks the blood supply to the fibroid.
Oh, okay.
And what it helps is that it starts to help it shrink.
So that would stop the fibroid itself from developing. I guess it would stun the growth of it. Is that what we?
Yeah. So it actually exactly. So sometimes it will dislodge the patient when they come back to St. Vincent. I may get a call to say, "Hey, Pauline, this piece came out," and sometimes I'm fortunate enough to even get pictures of what came out, and and let them know, yes, the fibroid has dislodged. It helps it shrink, which is great, and it gives women an opportunity to be able to get back to the normal life. Now, of course, every treatment may have its own side effect. If uterine artery embolization is not something that the patient wants, or depending on the fibroid and how advanced it is, what are the issues it's causing, our last resort really is the hysterectomy. The hysterectomy is basically where you're actually removing your uterus. So there is no chance after that of conceiving.
Yes.
And hysterectomies have a fair amount of time where you have to heal. It is invasive. So we try to avoid the hysterectomy as much as possible to give women an opportunity to keep as much of their reproductive organs inside.
Ms. DeFreitas, one of the reasons I invited you to this program is, and I could be an emotional person in that sometimes I see things go from concept to reality and realize that...
Sorry, your voice is very...
Realize that God is great. Well, I just received a message here. It says, "Hey, good day. I never listened to you more clearly before. It's a must right now as I am here laying down in bed for 3 days now. I have my period at this moment and always have fibrosis. Will listen to the end to get a contact number from her, please." Wow.
Yeah.
You see?
It is. It's a lot of women, and
those are the ones who are willing to come forward to let them, to send me a WhatsApp message to say, "Well, okay, what you talking about? I have this," because a lot of things about people with problems in St. Vincent and the Grenadines, sometimes we don't necessarily want to admit it. The propensity of anybody saying "I'm sorry" in St. Vincent and the Grenadines is very small. For some reason, this is something that we is not readily available to. It's almost like you don't see couples holding hands in Kingstown anymore. I mean, it's just things that we do.
Conservative society.
Yes. Like I said, this is.
No, you know what it is. I think part of it has to do with the fact that it's about reproductive health.
Mm-hmm.
Not everywhere in the world we're very open to talk about or discuss reproductive health.
Yes.
I remember as a young girl, I was raised in a Middle Eastern household. And, in the Middle East, these are not the things that you go out and discuss so openly. Religion plays a factor, upbringing, culture, all of that, right? And I think that's what it is. It's a personal matter. It has to do with your period. And it's even funny. I think if you go to the grocery store, up until I remember a few weeks ago, I went to the grocery store, and the young gentleman that was packing my groceries, and he came across my sanitary stuff, he's getting another bag, a black bag, to conceal it. And I looked at him and I said, "No, put it in the white bag. It's okay." He said, "Yeah, but it's personal."
Yes.
I said, "It's just a period. period. It's okay. We all get it. I said, honey, just put it in the white bag. And my husband was with me, and I think he had like the look of death on his face, like, oh my God, what is she doing traumatizing this boy? I'm not traumatizing. I'm telling you it's okay. It's okay. Period.
Yes.
And if you do have a period-related issue, it is okay to respectfully speak about it.
Mm-hmm.
That's the thing. You have to know. There has to be some form of discretion as to how you speak about something.
Mm-hmm.
So, to the women who are listening today, if you are facing a fibroid issue, if you're facing heavy periods, if you're facing periods that are painful and debilitating where you actually have to be on bed rest, you need to speak with somebody. We have some gynecologists on the island who are very well qualified gynecologists. And be seen. It'd be us at Health Solutions, fantastic. If it's not us and you have somebody already, please be seen. Have it investigated. Periods, yes, they give you pain, they give you cramps. They are, they really are a nuisance every month. But that's Mother Nature. That's what helps us become moms, to be able to bear the beautiful experience of a pregnancy. Don't be ashamed. Get help. Get seen and find out what it is. The sooner, the better.
In some ways, fibroids could lessen the chance of women getting pregnant. I think I know of 2 young ladies who suffer from fibroids, and that is one of the sides. That is one of the setbacks with it, is that it makes it more difficult.
Yeah, like fibroids, that there are cases where women have fibroids and actually have healthy pregnancies with minimal complications. But sometimes the fibroid size will increase during a pregnancy. So what will happen is actually it may increase your chances of a premature delivery. You may not be able to carry pregnancy to full term. It increases your chances of miscarriages, and in some cases where you actually have a breech baby, where it's a transverse lying position of the fetus coming out. There is bleeding. The bleeding after your labor, that is even heavier. So it depends, and that's why it's quite important to actually have them, keep an eye on them, and see how you could manage them.
Yes. Now, on the international scale, this being Fibroids Awareness Month. What is being done internationally with regards to bringing these issues to light?
So it's unfortunate because during months like these, all around the world, we're all out and about, presenting to women, meeting women, doing shows like this one, sometimes, face to face. Unfortunately, we have this thing that's right now affecting us, COVID, and it really has stopped us from being out and about. So one of the best ways that we could actually bring awareness is shows like this, posting stuff. I've started this month already, posting things on our Facebook page, on our Instagram page, giving women literature, and not lengthy literature where I lose you 2 minutes into reading. Just point out that this is an issue, and it is a huge issue in our Caribbean, and giving women resources, information, facts, and how do we help you?
Well, you see, in preparing myself for this, I didn't do a lot of things that I would like to, and that I'd like to do with the interview, is to have the element of surprise with it, wherein that is actually information that I am looking for, that I am curious about, and therefore it brings a genuineness. It brings a genuineness to the interview itself. But I don't know if you would have the time. Present time is 16 minutes after 12 o'clock. If we can open the lines to anybody,
we can open the lines. That's fine, and take a few calls. That's not a problem. Once it's like fibroid related.
Yes. 456-5967. 718-734-5615, wherever you are with a intention state of mind. Speak to the Managing Director of Health Solutions, Inc., Mrs. Pauline DeFreitas. The person on the WhatsApp sent me 2 prayer hands and says thanks. Well, Well, we're here for you. Okay, in the meantime, we can push up Sparrow just a little bit more. 456-5967 is the number to call, or 718-734-5615, or you can WhatsApp 784-497-6423. Do not suffer in silence. If you know somebody who might be affected with this, if you have questions, if you have comments to make, anything that you can share, 456-5967 or 718-734-5615, or you can WhatsApp us at 497-6423. All right. Seems like people are shy, don't want people to recognize your voice or whatever. But if you can give your contact information, you mentioned the Instagram.
Oh yes. So the clinic number is 451-2836, and the mobile WhatsApp is 434-3170.
Okay.
I mean, people can send emails and stuff, but I prefer a telephone call or a WhatsApp, because then I can ask the necessary questions so I know what type of clinic I need to put you in, what tests we have to do before you come in to see the gynecologist. So I'll ask a few questions and then go from there.
All right. This WhatsApp just came in, says, good afternoon. 15 years ago, I took in with a lot of pain in my back. I went to the hospital and the doctor did an ultrasound, and I was told I have fibroids. I get a lot of pelvis pain, constipation. Sometimes my blood looks black. What do I do?
Okay, so this woman has already had...
And she said, I also gained a lot of weight. Yes.
Okay, so does she still have the fibroids in?
Yes, she said, I was told that I have fibroids and I get a lot of pelvis pain and constipation. Yes.
So, depending on how long ago, I mean, she did say it was a long time ago.
She said 15 years ago she was diagnosed, yes.
Yeah, so it's been a while. I think number one in cases like this is because your initial diagnosis was so long ago, it would be best that you actually get an ultrasound done. So let's see if it's just that. Certain things that we do at times like this when, there's a concern, you could get a pap smear as well to make sure that there actually isn't an infection or abnormal cell growth, anything like that we need to look at. And then depending on your age, looking at your lifestyle, all of that, we take a look to see what is really the best way to treat you. If you were diagnosed 15 years ago, then obviously you're not a new onset case. It could just be that now the fibroids have either multiplied, have grown, and you would actually need a proper assessment at this point.
Yeah, she says the doctor now says it's the size of a grapefruit. All right, we have somebody else says was trying to call but not getting through from Philadelphia. 456-5967 is the number to call, or 718-734-5615, or you can send a WhatsApp message at 784-497-6423. All right, okay, here it says, good afternoon. If you have fibroids for a long time, can it turn into cancer? Okay.
Yeah, that's actually a good question. Generally, fibroids are known to be benign, so they are known to be non-cancerous. There is a very, very, very rare case where cancer becomes something that we look with a fibroid. But that is why it's very important to actually have images of it, look at it, what is it, and also make sure that there aren't other medical conditions internally happening as well.
All right, we have another question. What is the overall cost? You're going to have to call for that. What was the number again? Let me write that down.
It's 451 28 36.
And the WhatsApp number?
And the WhatsApp is 434 3170.
All right, great. Okay.
So, and with regards to cost, obviously depends on what you get. So between a consult, between an ultrasound, and between a pap smear, it'll probably range around about $300, I would say.
Okay.
I don't have my clinic fees all in front of me.
Yes.
But again, it's when you call and you let us know. We do ask you questions on the phone. There's the initial 5-6 questions myself or one of my nurses will ask you. And based on that, we will tell you what is the recommendation. And then when you come in, those are the things, and then you get a cost.
All right. Well, we have the WhatsApp machine blowing up. Oh, my God. Oh, boy, no, this is not the time for this. Somebody says sending out birthday greetings to Kenya Cordis of Clare Valley.
Oh, happy birthday.
Somebody's asking me to repeat the number. Once again, the phone number is 451-2836, or the WhatsApp is 434-3170. Okay? Did I have that right, Miss
Yes.
Yes, okay, great. All right, somebody from 267 says, very interesting program. Okay, well, thank you.
Something different. It is Fibroid Month. It is something that we need to bring attention to, and we need to make sure that our listeners know that it's something, to speak about. It is something that is impacting us here in St. Vincent with our women, and also in the region as well.
All right, this person might have not been listening for the entire thing. They ask, if you have fibroids, is it possible, if you have surgery for fibroids, is it possible to go back after some time? Yes, it is. I can answer that.
Yes,
because
fibroids can regrow after you have them removed. That's why if you have had them and you've removed them, you should be checking in with the doctor or the medical team that was attending to your fibroid. Generally when you have those removed, we look at 3 months, 6 months, even once a year, pending on the regrowth, if there's any.
Wow. Look, good afternoon. I'm happy to hear you have a very informative program about fibroids. A month and a half ago, I had to do a hysterectomy. Today I feel amazing. I suffered depression, loss of confidence, etc. I have a few friends who have fibroids, and it's better able to talk to them to get checked. Well, this is, yes. 5 more minutes, ladies and gentlemen. 5 more minutes, ladies and gentlemen. Any questions?
We could do a recap in the meantime.
Yes.
For people who are just kind of coming in even afterwards. I think when we look at fibroids, what we have to remember is that majority of the time these are benign, non-cancerous tumors. We call them tumors because they are growth within. The Afro-Caribbean population have a higher tendency, almost 3 times more tendency, and they're prevalent to getting fibroids. Part of the issue is estrogen levels. Part of the issue is being obese or overweight. Part of the issue could be that you have a lifestyle that is high in alcohol, caffeine, or red meat. A plant-based diet or a diet that's higher in plant-based than meat has shown that fibroids tend to not grow as much. It doesn't feed to the fibroid. When we talk about fibroids, we look at all kinds of symptoms, and a lot of the symptoms are actually quite difficult to bear and live with. Number one, women will start to complain about heavy periods. Women will complain that their periods are lasting longer. Some develop pain in their pelvic area or pressure, a heaviness. Also, women talk about back pain, leg pain, and then when the fibroids sometimes are large, they start to impact your urine output. It impacts your bowels, where you get constipated. And, the body starts to take a shape. Some women look like, we've seen cases where women have the abdomen getting as big as maybe looking like they're in their second month trimester in a pregnancy. Yeah. So obviously these are all will take effect into the woman's body. There's a body disturbance image, and again, like how that woman just said, there's a self-confidence issues that you have this lump that's growing inside you. With fibroids, some may be lucky that they might be small. They're like a seed size. And some women tend to have it as large as a watermelon. So it all depends. Sometimes they grow 1, 2. Sometimes they grow in 5, 6, 7. So the best way to do is get your female reproductive checks done. Yes. Make sure you are getting an annual pap smear for your overall reproductive health. Have a pelvic exam by a gynecologist. And if there is anything that is not normal for your body, have it checked earlier than later.
All right, okay. Somebody's asking what caused a woman to miss a period for several months. That might be pregnancy, but
hormones. There's quite a few things that may cause that. So I think the best way, to give us a call, and we can actually have certain tests done to investigate what would be the cause of that.
Yes, because the same person asks, Carl, can you ask your guest what caused a woman to see their period at times? And then they will go for 3 to 6 months without seeing their periods again.
Yeah, so I think one of the first things we look at in cases like that is when there's a hormone imbalance, or there's a fluctuation, something else that might be going inside. We check your thyroid. So there are things that women would just think, maybe it's just my ovaries, or maybe it's just my periods. But it's all hormone related as well. So we would actually do quite a thorough investigation on those.
All right. Somebody is saying, is there any history of fibroids affecting somebody after hysterectomy surgery?
Sorry, one more time?
Is there the possibility of fibroids coming back even after hysterectomy?
Well, the hysterectomy, what it does, the hysterectomy is supposed to remove your uterus. Okay. There's different types of hysterectomies that get done. If the uterus is left behind, then that's something, and if you have a history of it, then you have to speak with your medical provider as to why they would have left the uterus in.
All right. Miss DeFreitas was presently 12:30. Is anything that you would have prepared for that I didn't ask you? Anything that you think that is pertinent?
The exam generally, we ask that women come in when they're not on their period, so that if a pelvic exam has to be done, and then if a transvaginal ultrasound has to be done, it's best to have that done when you're not on your period. Sometimes, like the other day I had a lady come into her appointment and she was going to have an ultrasound, and she had a major lunch. So these are all the things that we look at. So when you do call the clinic to book an appointment, we will give you, based on what you are going to be having done, we'll give you the pre-appointment instructions.
All right. And, for what it's worth, the CTView Saturday show would always be here. Whether or not you're sponsoring me or not, because like I tell you, the females in my life are very precious to me. I have 1 daughter, 3 sisters. I grew up with a grandmother and an aunt in the house. So anything like this is something that it's dear to my heart, and to think that we can reach people of different zones. Like this morning we had calls from Philadelphia, from New York, 317 area code. I'm not sure where that is, but and if there's any way that we could be some part of fixing any problems here in St. Vincent and the Grenadines, CTView Multimedia is present, please. And let me thank you for taking the opportunity to come on the short notice, I might add. And once again, the telephone numbers for Health Solutions, correct me if I'm wrong, 451-2836, or the WhatsApp number is 434-3170. All right?
For sure.
And thank you. Thanks a million.
You are very welcome. Thank you for having me.
All righty. And
I hope all your listeners felt that this was informative.
Yeah, all righty. Okay, great. Thank you.
Take care, everybody. Bye. Have a good weekend.
You too. Bye.
Bye-bye.
Precious. Listen to the song. Listen to the song and understand. Something just came in from England. Yeah. Here you go. Hi, just to let you know something. You can have a lot of them. I have had 8 of them. Oh, wow. Somebody else is saying, repeat the WhatsApp. The WhatsApp is 4343170.
Joy and contentment and love. Your mother and I were so satisfied. We cherish you like a turtle dove. We were filled with bliss, the omnipotent said love. You make my heart sing, though I could hardly speak. You were so sweet, precious. That's how you'll always be, precious. Until eternity, you always will be, precious. Love you with all my heart, precious. From since we started, I knew from you I'll never part.
It's CTView Multimedia Saturday Show on radio. 90.3, 96.7, 101.3 Lights Radio.
As a baby now, gifted with your charms, you captured me with a spell you wore. Through your sparkling eyes, your dimple smile and your love. Wiped away your tears and allayed your fears, and stood by you when push came to shove. You made me understand through your affection and love. You make my life absolutely more complete. You're so unique, precious. You're always on my mind, precious. Yes, you're one.